my name's Ashton. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment. Before we begin, I'm going to wash my hands and apply proper PPE if needed. Can I have you verify your name and date of birth for me? Make sure the band matches up with the EMR. Before we begin, Margot, I'm going to ask you a few questions. Are you having any pain today? Can you tell me where you're at, what time it is, and what day it is? Patient is alert and oriented ×3. Do you feel safe at home? Any thoughts of harming yourself or others? Have you had any recent falls? No falls noted. All right, I'm going to inspect the overall appearance. Patient is pleasant, clean, and speech is normal. All right, I'm going to start by inspecting the scalp here. Scalp is warm, dry, and intact and appropriate for raise. No lice, no lesions, and hair is clean. I'm gonna move on to the ears. Ears look good. No drainage noted. All right, and then Margot, I'm gonna have you look at my finger here. I'm gonna shine this light. Eyes are round, equal, and reactive to light and accommodation. Then I'm gonna push on your sinuses. You let me know if you're having any pain. Any pain there? No. Conjunctiva is pink and sclera is white and clear. Gonna move down to your nares. Mucosa is pink and moist, no lesions or blood noted. All right, Margot, can you say ah for me? Good. Teeth and tongue are intact. Mouth is pink and moist. No odor, no lesions or blood. And then I'm gonna palpate your neck here for masses and bumps. No masses noted. Skin is warm, dry, and intact on the chest. Margot, can I have you look up and down and left and right? Patient's range of motion is good. All right, I'm gonna take a peek in your gown here. Nipples and breasts and areolas are symmetrical and appropriate for raise. I'm gonna start by listening to your lung sounds in 6 spots. I'll have you take a deep breath in and out. In and out, in and out, in and out, in and out, in and out. Good. Now I'm going to check your Tuger. Less than 3 seconds. In your armpits, are you having any pain? No pain noted. And now I'm gonna roll you to your side here and check your back. Gonna osculate here. Skin is warm, dry, and intact. I'll have you take a deep breath in and out. 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 Buttocks has no lesions or bed sores present. All right, now I'm going to move down to your abdomen. Skin is warm, dry, and intact and appropriate for raise. Belly button is symmetrical and not protruding. Have you had any recent bowel movements? Any pain or concerns with that? Good. Now I'm going to listen to your abdomen. I'm going to start in the right lower, moving up to the right upper, left upper, and left lower. Bowel sounds present in all 4 quadrants. Now I'm going to palpate. You let me know if there's any pain here. Left upper, left lower. Good. I'm going to pull down your gown. Have you had any trouble with urinating, any frequency or blood? issues there. And now I'm going to check your upper extremities. Arms are warm, dry, and intact and appropriate for race. I'm gonna palpate here or check for the pulse here. 2+ bilaterally. No edema noted. I'm gonna have you grip my hands. Good. Strength is bilaterally strong. Now I'm gonna check the capillary refill. Less than 3 seconds. Good. All right, now I'm gonna move down to your lower extremities here. I'm gonna lift up the blankets. Skin is warm, dry, and intact, and appropriate for race. No edema noted. I'll have you push on my hands like you're pushing a gas pedal. Good. And then pull. Good. Now I'm gonna check the pulse. 2+ bilaterally, and check capillary refill, less than 3. That is the conclusion of the head to toe assessment. Do you have any other questions or concerns? I'm going to document my findings, perform hand hygiene. I'm gonna lower the bed. Are you comfortable, Margot? Give my patient the call light and clean my stuff that I use for this head to toe assessment.